here that looks similar to that. So on this side, here is, what's the most external lateral abdominal wall muscle? External abdominal oblique. Okay? And so in cross section, its fibers are right here, but it's fascia. Remember how muscles are covered with epimysium? And then that becomes tendon when it attaches to the bone. So the tendon and fascia of the external abdominal oblique is coming down to attach to the pubic bone, and it forms these arching fibers of the superficial inguinal ring. They also wrap underneath to form the floor, the outside wall and the floor of the inguinal canal. Now the inguinal canal has been opened on this side, similar to on that diagram. And so you're seeing the contents of the inguinal canal. And up here at the top would be where the deep inguinal ring is. It's already been opened, so the concept of that as an inguinal ring can be difficult to recognize. So let's move over here to this model. You may not all be able to see it, but from this view, here's the aorta, okay? And it gives rise to a branch that's going to give blood vessels to the pelvis and move into the lower extremity. And here, this yellowish brown structure right here is the vas deferens. And it passes to the anterior abdominal wall and disappears. And that's where the deep inguinal ring is. All right, on the inside, on the deep surface of the anterior abdominal wall. The rest of that is covered by skin. So there's, let me move ahead to another image of that deep surface of the anterior abdominal wall. And here we go. So here's the inside of the anterior abdominal cavity, Here's rectus abdominis. Here's transverse abdominis muscle, which is the deepest. And here's the vas deferens, testicular artery and vein disappearing or coming into the cavity. And that opening right there is the deep inguinal ring. Okay. So when we have a hernia that we'll talk about in a few minutes, we can have a weakened muscle area right here where the obliques are the linea semilunaris, where the obliques meet the rectus abdominis. And that can be weakened, and we can go into the inguinal canal that way, or we can go in through the ring. All right? That creates a hernia. But let's take a look at the structures that form the wall of the inguinal canal. You have this diagram on page 50. This is from Netters. All right? And it provided me the clear, because I've always had difficulty, or students have always had difficulty understanding these layers because they're offset from each other. It's not like you could have a tunnel. When I say a canal or a tunnel with various walls, individuals would think about, so we have a building block, and it has an arch like that, okay? And you would have a whole series of those, and you would have a tunnel. That's what we've done here, except those structures are offset slightly. So we are going anterior and medial. My perspective here is somewhat to be desired. So if something's going to pass through here from deep to superficial, it's going to come at an angle. All right, so you take these wooden blocks and set them up. It's not a straight line. It comes at an angle, or it leaves at an angle. So here is the spermatic cord. This is vas deferens, testicular artery, testicular veins. and it's passing into the inguinal canal, or out of, depending on which structure we're talking about. Here's the superficial inguinal ring, and as it passes through this, here's where it comes out, and there's the vas deferens. So this is what is opened in that previous image of the inguinal canal. So the layers of the inguinal canal are given on page 50, up at the top. You don't have to know all of those, but let me emphasize the ones I do want you to know. So the superficial ring, right here, and on the model, this, not the cut one, but up here, all right, this tissue is made up of the fascia, or the connective tissue, of the external abdominal oblique. That fascia, tendon, if you will, comes down and wraps over, forming the roof of the inguinal canal, the floor, and then has the opening in it for the superficial inguinal ring. That fascia is identified as the external spermatic fascia. So remember I said that in this portion of reproductive, I'm going to talk about what develops from what, or what has the origin. And so vas deferens has its origin from the mesonephric duct, and epididymis has its origin from the mesonephric duct. So here we have the external spermatic fascia has its origin from the connective tissue of the external abdominal oblique. Okay? Everybody with me on that? Then slightly deeper, what's the next muscle? Internal abdominal oblique. All right, so as we follow this muscle, the muscle itself arches over the spermatic cord, the vas deferens and its blood vessels. Not only does the muscle arch over, but it gives some of its muscle fibers to the spermatic cord. Skeletal or smooth? Skeletal. Internal abdominal oblique is a skeletal muscle. All right. So these fibers are known as cremaster muscle. Skeletal fibers. And they have their origin from the internal abdominal oblique. And they wrap around the spermatic cord. And that would be these pink lines right here. Those are referring to the cremaster muscle fibers. So the external spermatic fascia has already been removed. Okay. So you see right here. The next layer is the transverse muscle, transversalis abdominis, and the transversalis fascia. We're not going to worry about those. Okay, you don't have to worry about those. The next layer is the peritoneum. Now, the testis, as it moves into the spermatic cord, actually pushes through and takes these layers with it. So it's like I had sheets hanging over a clothesline. So I don't see that anymore. But let's say as I walk through them, I'm pushing them in front of me. So now I'm kind of forming a pocket. And I have the first sheet, and then I walk into the second sheet, and that's completely surrounding me. So as the testis is moving through these layers of the abdominal wall, it's taking it with them. And so it's completely surrounded by all of those. But remember, it was behind the peritoneum. It's not going to be in here and push through the peritoneum. It was behind it already. So think of the testis sliding down the posterior abdominal wall, And as it reaches the opening to the inguinal canal, anthropomorphic, it reaches out and it grabs a piece of that peritoneum and pulls it down with it as it slides down into the scrotum. So that piece of peritoneum is going to be only in the anterior aspect of the testis rather than completely surrounding it. So what I'm describing, I'll draw it larger, is here's the scrotum, and the testes pulls in a layer, and it pulls another layer in, but the peritoneum is only in front. Okay, think about grabbing it, it's a double layer, because it's pulling it down into that opening, but it's only in front of the testes. So that becomes a layer, a double layer known as the tunica vaginalis. So you guys have missed out. You actually have a vagina. You have two of them. I've never gone to those, what are they called? The monologue, the vagina, something or another. So I don't know if she talks about vagina envy, but anyway. Tunica vaginalis just really means that invagination, a formation of an inward sac. So here are the layers that I've talked about, and I'm going to diagram them on the board with you because you don't have this diagram in the lecture notes. And talk about, this would be the space in the scrotum where the testes is and the layers of those components. All right? So I'm going to include these and diagram this in a fashion similar to that. So the black line is going to be the skin of the scrotal sac and the spermatic cord wall. I just kind of shorten that wall. Skin. Right? So we're looking at this structure right here, okay, of the scrotum. And the upward component here has just been foreshortened, a little bit short. Now, within the skin is a layer of smooth muscle in the deep part, the deep layer of the skin. And this is smooth muscle, known as the dartos muscle. When it contracts, it wrinkles up the scrotal skin. Its function is to help to keep the temperature of the testes from getting too cold rather than too hot. This is smooth muscle, so it's under autonomic control. And that's this yellow line on the diagram. The next is the external abdominal oblique up here. But remember, that muscle doesn't extend into the inguinal canal. Only its fascia does. So this layer would be the external spermatic fascia. This would be the internal abdominal oblique, and its fibers do completely extend into and surround the testis.